Good afternoon, everyone. Happy New Year. I hope you all had a good New Year's Eve and New Year's Day, quiet or subdued as it may have been. But here we are in 2021. Certainly, I'm very optimistic about 2021 because it won't be worse than 2020, right? 2020 is something we'll all talk about for generations to come. So today, the main thing really that I want to chat with you about is COVID. And of course, we'll take your questions on any other topics as well. So first of all, the numbers. The COVID numbers in the city of St. Louis are running about 100 cases, new cases for 7-day average. So that's 34 per 100,000. It remains to be the lowest rate in the region and considerably lower than the state. State averages is 51. So we are encouraged by that. That's pretty consistent in terms of where we have been. We believe it's because we have a pretty high level of mask compliance and high level of folks following the mitigation strategies that we've laid out for people. Wear your mask, social distance, wash your hands. We also attribute it to really our good businesses, the vast majority of which are following the COVID guidelines for their industry. So we think that that's paid off now. There's still too many cases, but ratably better than other areas. So yesterday, the city of St. Louis reported a little over 100 cases, 124 on yesterday. The day before was 46. So we averaged the last 7 days to get an average of 102 per day. We expect that's going to go up. There was more limited testing over the holidays than there is in a normal week. And so we expect between additional testing, but also as cases develop as a result of people's activities over Christmas and between Christmas and New Year's. And while we know that most people followed the guidelines, we also know that some did gather in large groups. So we are expecting that there will be some increase in cases as a result of that activity. We hope it's not too much. Number of people in the hospital, these are regional numbers and they lag 2 days behind. So here we are on Monday. So this is likely the Saturday cases. There were a total of 858 people in the hospitals in our region, in the 4 major hospital systems. 179 of those people were in ICU, and 112 of those folks were on ventilators. And so still high numbers of people in both the hospital, the ICU, and on ventilators, although it has come down as much as 100 people over the last month or so. Excuse me, let me turn my phone off. There we go. So that's some good news. As we see cases begin to decline, we're likely to see less hospitalization. Number of cases a week to 10 days later is reflected in the hospitalization numbers. So those are the COVID numbers for today. I should also mention that in the city of St. Louis, we've had 308 deaths attributable to COVID since the pandemic began. So that is a very concerning number. And you know, those are not statistics, they're not numbers, those are real people. That's somebody's mom, somebody's dad, somebody's brother, sister, aunt, uncle. And so that, of course, is what we are all trying to avoid. I will show you, this is the new chart from the pandemic task force. We'll post these also, but just to look at the yellow line here, you can see that and this is the moving average of the new COVID hospitalizations. You can see that it is going down. New daily COVID admissions, 7-day moving average of 95 people per day. So those are the COVID numbers as we head into this new year. I think we're all encouraged by the vaccines that have rolled out. We'd like for them to roll out faster, and we'd like for more people to be getting them, but we know that a number of thousands of folks who work in hospitals have. Who work in hospitals have received the vaccine. We expect more and more to roll out over the next few weeks, so that the people that are in 1A, which is frontline healthcare workers, as well as folks in nursing homes, will be hospitalized will be vaccinated within the next few weeks. Questions?
A few questions today. Not a whole lot, but a couple. On the vaccine note, Mayor, Patrick's question has to do with a timeline in the St. Louis area for when more folks will have access to getting that vaccine, and how will that information be shared?
Well, Patrick, thank you for that. I think if you were with us last week, you know that I did spend some time on Wednesday speaking with Dr. Randall Williams, who's the State Director of Health. And he is expecting more and more of the vaccine to come in really every single day as these rollouts, as the production and then the rollout is increased. So I would expect, I'm trying to remember the number, about 350,000 doses of the vaccine that had been shipped or were in the process of being shipped to Missouri, and then from Missouri both to the hospitals and to the nursing homes. It's distributed out, so we're expecting much more over the next few weeks.
Janice has a similar question about vaccine availability in the city of St. Louis. Do we know when it becomes available at private entities like a doctor's office, a drugstore, Walgreens, or CVS?
So Walgreens and CVS have a contract with a number of nursing homes to provide vaccinations in the nursing homes. In terms of just a general public walk-in, it's my understanding that that's still several months away, because the priority is frontline healthcare workers, nursing home staff and residents, first responders, police, fire, EMS, people who work on ambulances. And so all of those folks have to get served. Oh, and people over 65, they're in the next group along with first responders. All those folks will be vaccinated first, and then after that, more available to the general public.
We got a question from Sarah today, Mayor. Do you know what participation rate looks like of the available vaccine? How many folks are actually getting it when it is available to them?
Well, Dr. Williams informed me last Wednesday that the participation rate is increasing. While initially it was expected it might not be much more than half, he's looking at probably 60%. And as more and more people receive the vaccine with little or no ill effects, then hopefully it will be more accepted. And I think that will be true. I've talked to a number of people who, if you would have asked them, 6 weeks ago, oh, will you get the vaccine? They might have been hesitant, but today they're seeing the results of this vaccine and understanding that the vaccine at this point, along with the mitigation strategies, is really the only way to get folks back to work and back to being able to some semblance of normal.
We had a question from Ned, update on the new stimulus package in Washington, and really, will there be more rental assistance available to the city of St. Louis through the second relief package?
Yes, Ned, there will be more rental assistance available to the city of St. Louis and the region, of course, through this, I call it CARES Act 2 package that was just passed here a few days ago. So there will be more. There still is ongoing rental and mortgage assistance now from the first CARES Act package. And as you know, we have about a dozen agencies that we are working with who are processing applications, taking documentation, and getting landlords paid for those months of rent, up to 3 months of rent that the tenant was unable to pay because of a COVID-related reduction in hours, loss of job, etc.
We have just one more question today. Separate topic, downtown. Michael's question has to do with some of the barriers that have been placed on the streets downtown. When will they finally be removed?
You know, Michael, we are, the barriers have been pretty effective in terms of slowing traffic, reducing traffic, and reducing some of the reckless and illegal driving that was happening. Now, you know, as we look towards spring here, we're going to reevaluate whether or not we want to leave those in place. The other thing, of course, is that when we get snow, which I hope it's not soon, some of you hope it is soon, I know you're looking forward to snow, but when we get snow, we likely move some of those barriers to the side so that we can plow the streets.
That's it for the new questions today, Mayor.
Must not be very many people with us today, but thank you to those of you who are with us, and we'll be back on Wednesday to talk more about this. I think if you're like I am, we're just easing back into this week after a couple of days off, and I hope you had some days off. First of all, I know many of you worked. For those of you who didn't have to work, I hope you enjoyed your time off. Happy New Year, St. Louis, and looking forward to a great 2021. Thank you.